Hello, and thank you for joining us for the 7th Annual White Coat Ceremony at Mount St. Joseph University. I'm Nancy Heinzman, the Assistant Dean of Nursing. On behalf of the faculty and staff of the Department of Nursing, I want to extend a warm welcome to everyone as we celebrate an exciting milestone in the education of our students, the class of 2023. Students, tonight you will receive your lab coats, referred to as white coats. This symbolizes your entry into the clinical aspect of the nursing program. We recognize that you're taking your first steps toward becoming clinicians. The first white coat ceremony took place in 1993. It was instituted by the Arnold P. Gold Foundation. Dr. Gold, a professor of clinical neurology and pediatrics at Columbia University, noted that the existing practice of having students take the Hippocratic Oath at the end of their medical training occurred far too late. He recognized the importance of emphasizing humanism at the beginning of medical training. While the first white coat ceremonies were for physicians, the Gold Foundation partnered with the American Association of Colleges of Nursing to adopt the practice for nursing in 2014, recognizing the vital role that nurses play as part of the healthcare team. Our ceremony tonight not only marks an exciting milestone for our students, it also recognizes the goals of the Gold Foundation to elevate healthcare by emphasizing the importance of compassionate, collaborative, and scientifically excellent care. Humanistic medical care is not simply about compassion. It is the best of medicine. When skilled clinicians build caring, trusting, and collaborative relationships with clients, studies reveal that more appropriate medical decisions are made. There is enhanced client adherence with treatment plans and less costly healthcare outcomes. I'd like to share a quick story with you. As a 16-year-old, I got a job at Hillebrand Nursing Home in Cheviot. Some of you are probably familiar with that still. It's an extended care facility, and my job was as a nursing assistant to bathe, feed, and otherwise care for the elderly residents there. One day I was asked to help an elderly client with a shower. I remember she had a glorious head of hair who somebody lovingly came every week to style. And I was told, Nancy, please don't mess her hair up. It's beautiful. And so with that in mind, I gathered what I needed. I approached the patient and got her undressed and into a chair, covered her with blankets to keep her warm and to maintain her privacy, and wheeled her across the hall where the shower was. I adjusted the water and finally ready, stood her up thinking, don't mess up her hair. As I stood her up, she looked at me and said, uh-oh. And as she said, uh-oh, I felt a warm stream of urine traveling down my leg, which was supporting her and into my shoe. What I want to say to you is you're going to have many uh-oh experiences as a student and as a nurse. And it's your humanistic response to those uh-oh moments that will define your career. So may you handle all your uh-oh moments with the utmost integrity and care for your client. Thank you.
Let us pause for a moment, recognizing the presence of God within us and among us, in person and virtually. Good and gracious God, we ask you to help us remember that vocation of nursing is just that, a vocation. It's not a job. It's not just something we do. It's something that we are called to do. It's something that each one of these men and women are called to. It's a divine opportunity to engage with people when they are vulnerable, when they're scared, when they're hurting. And it's a call for you to respond, to dare to risk a caring response. You are embracing a proud and time-honored tradition by embracing the call of nursing. It's a profession that is greatly respected, not just in the United States, but worldwide. And as we begin our nursing penning ceremony, we want to remember all of the sacred ancestors, those who brought each one of you to this moment, those who have gone before you. And I ask you in this moment to remember your loved ones, to see their faces, and to give thanks to God for the goodness and the inspiration they have brought to your life. We also remember Florence Nightingale and Sister Anthony O'Connell, a Sister of Charity of Cincinnati, who served in 17 battles of the Civil War, serving both Union and Confederate soldiers, taking care of people who were wounded and dying, with whom she disagreed, some of whom held Catholics in great disdain and disrespect. But Sister Anthony O'Connell, in the spirit of nursing, cared for them. And as her vocation, she ministered to them while they were sick and dying. She was daring to risk a caring response. And we pray that God will give you the courage in your vocation as nurses to do the same. We remember the Gospel of Matthew, where Jesus calls each one of us, "Come, you that are blessed by my Father, and inherit the kingdom prepared from you from the foundation of the world. For I was hungry, and you gave me something to eat. I was thirsty, and you gave me something to drink. I was a stranger, and you welcomed me. I was naked, and you clothed me. I was sick, and you cared for me. I was in prison, and you visited me." And then the righteous will say to him, "Lord, when did we see you sick and care for you, or hungry or thirsty and give you something to eat or drink, or naked and clothe you, or in prison and visit you?" And the Lord answered, saying, "Truly I tell you, as long as you did this for one of the least of my brothers or sisters, you did it for me." In a world that's tragically divided by race, religion, economics, politics, age, and all of the other sociological demographics that divide us as human and classify us and put us into boxes, the profession of nursing and the proud heritage that you embrace calls each of us to realize that we are all human beings. We are persons made in the divine image and likeness of God. And in this spirit, I remind you, our dear graduates, of your vocation. It's a sacred calling, and I impress upon you the words of St. Elizabeth Ann Seton, who founded the Sisters of Charity of Cincinnati, who founded Mount St. Joseph University. Dare to risk a caring response. In your profession as a nurse, in your vocation as a nurse, in all that you do, I beg you, dare to risk a caring response. Amen.
Tonight, our speaker for the white coat ceremony is Catherine Fulmer. Catherine has been a nurse and worked in healthcare for nearly 45 years. For 37 years, she worked for the Mercy System, formerly known as Catholic Health Partners and presently known as Bon Secours Mercy Health System. Bon Secours is a large, multi-state, not-for-profit Catholic health system, and it's the largest in the state of Ohio. The system consists of multiple organizations, including acute care hospitals, outpatient clinics and programs, primary care and specialty physicians, as well as clinically integrated network committed to value-based care and payment transformation. Catherine has held multiple positions for the system, spanning acute and home care, and during the last 15 years of her tenure, she worked at the system corporate level in a vice president position, covering multiple states with a focus on coordination of care. Catherine's passion was connecting the dots throughout the patient's healthcare journey to provide a high-quality, seamless transition of care. Catherine provided strategic and operational leadership for multiple areas, including care transitions, acute care case management, palliative care, and post-acute services. She engineered and led innovative practice modalities, including an integrated care coordination model and the post-acute providers and physician networks. Included in these practice modalities were key initiatives such as CMS Bundle Payment Project, decreasing length of stay, reducing hospitalizations, and improving quality of services throughout the continuum. She engineered and led innovative practice modalities, including an integrated care coordination model and the post-acute providers and physician networks. Included in these practice modalities were key initiatives such as CMS Bundle Payment Project, decreasing length of stay, reducing hospitalizations, and improving quality of services throughout the continuum. Catherine has delivered multiple presentations at the Catholic Healthcare Symposium for Home Care and Long-Term Care and various other organizations and associations. Catherine is the past chair for the Supportive Care Coalition and the Catholic Health Association Care Continuum Committee, as well as she has served on multiple committees during her time. Catherine has also published several articles in Supportive Care's Voices, Catholic Health Partners, and Health Leaders magazine. Presently, Kathy is semi-retired, working as an adjunct clinical faculty at Mount St. Joseph University in the Department of Nursing. She enjoys the enthusiasm of the students and the ability to share her clinical experiences in a way that influences their education. Ladies and gentlemen, Kathy Fulmer.
Hello. I just want to say that I was honored to be here today, to be asked to speak at your white coat ceremony. What an exciting time for you. Starting your clinicals, you're able to take what you've learned and put them into action. But it's a scary time. I know, we've all been there. But as you develop your skills, it will become second nature. Some of you may recognize me as I am in my semi-retirement. I am working as adjunct faculty here at Mount St. Joe, and I work with Professor Getz with the Friday Health Assessment Labs. When I retired in February of 2019, I still wanted to do something. I wanted to make a difference. I wanted to give back. So I had gotten my BSN here at Mount St. Joe in 2000. Basically, I had already had my RN. You had a Saturday program. That seemed to work out well for me with my schedule at the time, and my kids were teenagers. I loved Mount St. Joe. It felt right to me. It felt like it was a good fit. So now that I want to do something and possibly give back and possibly try my hand in teaching, I decided to call the dean, Dr. Vale, and see if one, she remembered me, and two, if she had any opportunities for me. She hooked me up with the assistant dean, Dr. Heisman. And henceforth, I started my little retirement gig. I will say it's been fulfilling. It's been a fulfilling experience. I love the energy you all bring to the table, each and every class. I see the light in your eye as you learn and the fire in your belly. I love to inject my 2 cents, as those whose assignments I grade know my little comments of food for thought. Remember to peel back the onion, think like a detective, look past the obvious, don't underestimate the impact of culture, religion, and heritage, and most importantly, listen to the patient. I have been in healthcare for 45 years, and I will say I loved every minute of it. When people ask what was my favorite area, I grin and answer that each was my favorite area at that time of my life. I would never want to wish any of it away. All my experiences over the years strengthened me and made me who I am, a sound nurse, a strong leader. I love learning and always strive to connect the dots, understand the whole picture. In my years in the acute care, I did time in oncology, med-surg, telemetry, and ICU and the ED. I loved the progression of knowledge that afforded me and the development of strong, sound skills. I was always perplexed with the frequent flyers. You know, the ones that come in, they get the fluid off their heart, we get their blood glucose under control, their lungs to a desirable state. They got the appropriate diet, exercise, and meds here. We sent them home with the perfect care plan that we developed. Why are they back? What are we missing? That haunted me. So in 1986, I transferred to home care. After all, we're doing everything right in the acute care. It had to be those community folks. Well, for what I thought was an extremely competent nurse, I was humbled at what I learned and the false assumptions I believed. I learned the new meaning to think outside the box, and many times there was no box to think out of. I was grabbing ideas out of the air and on the fly. I had a vast territory. I had the wealthy, the inner city, the middle class, and the rural. It was indoctrination by fire. I quickly learned the truth to that saying, a home is a person's castle, that no matter what their home is like, it's still their castle. One thing that became abundantly clear to me, when the patient is in the acute care setting, those bricks and mortar, they are our guest. We dictate, control, for the most part, what they do. Think about it. The meds, activity, diet, all controlled by the plan we develop. And as guests, for the most part, they go along with it. First lesson learned in home care. I'm a guest in their castle. Unless I can influence them, I'm not going to get anywhere. And if they feel you're trying to control them, you'll get nowhere except the door. I learned how important key senses were. The eyes, the ears, the nose. I learned to listen, not just hear. To look and see the surroundings. Does it match what I'm hearing and smelling? They say they have no problem getting up to the bathroom and doing chores. And my nose smells stale urine, and my eyes see a litter box overflowing, which hasn't been emptied in weeks, and urine stains on the furniture. They say they're following a low-sodium diet. We tour the kitchen. If I play my cards right, they may let me open the cabinets and the refrigerator. What I find is canned soup, frozen meals, and cold pizza. Not exactly in the low-sodium diet. Let's talk meds. I would ask to see their meds. They'd point me to a cabinet, a chest, a drawer, and a bag, sometimes all four. I would find multiple meds, some expired, some not even theirs. It could have been a spouse or a significant other. Some could be their dogs, multiple pharmacies, and a lot of times the same med, but generic and name brand. It was a crapshoot, what they were taking and when. So different than in the hospital and the long-term care settings, when you go to the nursing drawer and all the medications are in there by the pharmacy and labeled. I became a detective like Sherlock Holmes, Watson, and Columbo, but I knew not to quit my day job. I learned to listen to what they knew about their health, what that meant to them, and what their goals were, not mine. I could present them the facts on their disease process and the impact of their choices, but they had to make the choice. The diabetic that was a 40-year-old alcoholic was not going to stop drinking because I said it impacted his blood sugar. The COPDer that smoked for 60 years was not going to quit because I told him to. The best I could do was influence, listen, help them see the link between making some modifications, feeling better, and their goals, what was important to them. It was baby steps with the consistent need to recognize and celebrate progress, even the small. And if they felt better, capitalize on that and help them increase their modifications. My role was to influence and inform, not to dictate. That was a hard lesson to learn. I learned not to let perfection be the enemy of good. My goals went from perfection to improving the quality of their life to trying to get them to their best, safest self. I had many humbling moments, which when I look back, kept me grounded. I had great years in home care. I developed their infusion program and ended up the executive director. That gave me the opportunity to get at the table with the acute care leaders. And I preached how, in general, the health systems are broken. We operated in silos. It wasn't all about the acute care bricks and mortar. To meet the needs of the patients that entrusted us with their lives, no matter what setting, we had to connect the dots. It was all about the patient. Well, my voice did get heard. In 2005, I was promoted to the parent company in a VP position which spanned multiple states. My charge was to connect the dots in the acute care, through the acute care, to whatever post-acute and community services they were going to. Old saying, be careful what you wish for. But I had a blast. I had learned a lot during my frontline days: influence, not control; key senses, to inspect, not expect; to ask, not assume; and the importance of teamwork. All those skills served me well in my new position. Working in the different states, trying to develop models of care that connected the dots between all settings of care was exhilarating and frustrating. They all had their own unique challenges and regulations. I soon learned there was no carbon copy. Scranton, Pennsylvania; Paducah, Kentucky; Tennessee, and Ohio all had their own nuances, different payment models. Even in Ohio, with the same regulations and payment models, Cincinnati, Springfield, Youngstown, Lorain, Willard and Tiffin, Toledo, they're all different. When I went to the different regions, I always did a windshield survey of the communities. I would go to the local nail salon and sit and get my nails done. Then I'd go to the local eateries and I would listen to the stories of the locals. And that really helped me get to know what was important in that community. And I'll share one with you. We had a small rural area, and we were thinking of opening up a hospice. There had been a hospice there for 50 years, and it seemed to be struggling, and there was talk that it was going to close. But it was really the pillar of that community. It was started by local people that had lived there for generations. The big box hospices were coming in, and so we thought we would go ahead and maybe look at starting our own. We had hospices in other markets. Well, from what I found, the locals were really devastated that the big boxes were coming in and that the little guy was getting pushed out, because that had such ties to them, because these people had been in the community. They were pillars in the community that started this. And it was starting to struggle, but they were really at odds with the big boxes coming in. And I knew they would be at odds with us also. So instead of opening our own or aligning with a big box who has a lot of bells and whistles, we went ahead and we aligned with the little mom and pop, gave it the resources it needs so it could stay open and be successful. So I learned that you don't have to build everything. New isn't better. And sometimes don't be too impressed by the new shiny objects, because sometimes the old work just as well. I continually added skills to my growing bag of tricks that I had earned from my frontline days in my different roles. My past roles, as I said, had served me well, and I had a great career. And I was fortunate to have a great team that supported me in all the different markets. We made a difference, and I couldn't have done it without my team. So now let's talk some hard realities. You're starting out young nurses, and nursing can be very emotional. And there'll be days that you want to throw in the towel. As a new nurse, you will be developing coping skills. Remember, you're part of a team. Share your feelings. They've all been there. Utilize the resources available. There are the firsts that you'll always remember. I can still remember my first code. It was a 72-year-old patient that had abdominal surgery. She did great. She was going home the next day. I was working evening shift. The aide just finished picking up her tray. There was spaghetti being served that night and pudding. She ate all her spaghetti, but none of her pudding. I went in because I wanted to go over her discharge instructions with her to make sure she was ready for the next day. All of a sudden, she went out on me. I jumped into action. I called the code, and I started CPR and chest compressions. Back then, we didn't have the protective equipment we have now. The team came in. They tried to save her life. Time of death was 6:52. I was shell-shocked. So shell-shocked that I did not realize that she had vomited her spaghetti all over my neck, all over my white uniform. I went back to the desk and I was frantically going through the chart. What did I miss? The ED doc that led the code came flying around the corner. He was a big burly guy, and he had practiced in the military overseas, so he was used to performing in the trenches. He didn't have a warm, fuzzy bone in his body, but he was an excellent doc. And he had a pair of scrubs, and he barked my name, Fulmer. He threw the scrubs at me and told me to go down to the ED night room, take a shower, put the scrubs on, get back up there. The family was coming in and he wanted me to meet with him. And also I had other patients. I was dumbfounded. I was taken back. I just lost a patient. I can't believe he's barking orders like this at me. Then he turned and he said, "And Fulmer, you did a great job. There's nothing else we could have done." I needed to hear those words at that time. So I went down, I changed. With heavy heart, we met with the family. And then I got back on the bus and I learned and I went on. And there were other days that I had like that, but that was my first coat, and I can remember everything down to the earrings that I had on. And you too will have those days. You'll always remember your first bad and your first good. You'll also learn a meaning that I was told back in the 70s. Death comes to some as a friend in the night, and to others, it comes as a thief in the dark. So let's go to food for thought, my favorite topic. Remember to use your key senses, eyes, ears, and nose. When you're with the patient, be with them. Learn about them, what they would be doing if they were home at that time. It's amazing what you'll find out about them, what you'll find out about their home situation. They may be the sole caregiver of someone, a pet, or a person. You'll be amazed what you find out. It will help you coordinate their best, safest transition of care. Connect the dots. You're not alone, you're part of a team. Learn early the team isn't just the setting you're in. So if you're in the acute care, the team is also your community and post-acute services. Look at who's involved, who can be involved, and together plan the best care you can, the best transition for the patient. Your due diligence, they will benefit. Work on expanding your circle of influence, not control. If you're not sure or your gut tells you something's wrong, stop, breathe, take a step back, look deeper, ask questions, seek help. Remember, you were never too old to learn. I didn't get my master's till I was 50. I have a friend getting his doctorate. I'm so proud of him at 72. If you pick a specialty, get certified. Be your best self. If you end up in leadership, remember, your voice can be heard. You can still make a difference at the bedside. Also remember a key finding, employees are your greatest asset. Listen to them. If you find your light dimming and the fire in your belly beginning to fade, look inside yourself. There are many avenues in nursing. Never feel stuck, so you become complacent. Don't be your own obstacle. So my wish for you is that you're always proud to be a nurse. You never lose that sparkle in your eye or the fire in your belly. And when you end your career, you look back as I do with pride. Maybe in 40 or 50 years from now, you'll have the opportunity to stand up here and give some food for thought to another generation of nursing professionals. I wish you luck in your careers and in connecting the dots.
Thank you, Kathy. And now for the presentation of the White Coats.
Maria Aguilar, Marlo Alsop, Brooke Asalagi, Samantha Bowen, Sydney Cosgrove, Madison Kreider, Emma Zerwinski, Jillian Donahue Boyd, Mackenzie Egan, Claire Fleming, Madison Hart, Kimberly Harold, Kendra Hunter, Nathan Lacey, Kelly Melvin, Megan Meyer, Lauren Middendorf, Madeline Otten, Kelsey Phillips, Journey Rushing, Lauren Schutte, Anna Schwer-Johann, Noah Schrock, Kelly Smith, Abigail Strack, Hannah Taylor, Lauren Taylor, Elizabeth Wade, Ashley Wilson, and Addie Yaboa.
I now invite Dr. Darla Vale, Dean of Health Sciences, to the podium to lead the students in reciting the Gold Humanism Oath.
So class of 2023, please repeat after me. I pledge by all that I hold dear as a nurse.
I pledge all that I hold dear as a nurse.
I will care for my patients with compassion, respect, empathy, integrity, and clinical excellence.
I will care for my patients with compassion, respect, empathy, integrity, and clinical excellence.
I will listen to my patients with my whole being.
I will listen to my patients with my whole being.
I will advocate for each patient as a unique individual.
I will advocate for each patient as a unique individual.
I will remember always the healing power of acts of caring.
I will remember always the healing power of acts of caring.
I will dedicate myself to joining with others to make healthcare optimal for all.
I will dedicate myself to joining with others to make healthcare optimal for all.
With this pledge, I accept the duties and responsibilities that embody the nursing profession.
With this pledge, I accept the duties and responsibilities that embody the nursing profession.
Class of 2023, we know that you will go forth and provide compassionate, collaborative, and excellent care. We are excited to see what you will accomplish over the course of your time at Mount St. Joseph University. We will be here to support you along your journey. Congratulations. This concludes the white coat ceremony. Thank you for joining us and enjoy your evening.